So we're delighted to be joined finally by Dr. Owen Williams from Calderdale and Huddersfield. He's a chief executive, and he's going to be talking about the rise of the digital Diversiast. Now, Owen, I don't know whether you've made that work up, but I'm definitely going to steal it and use it in the future. So can I hand over to you now, Owen? Thank you very much.
Thank you, Louise, and hopefully everybody can hear me. Thanks for this opportunity. I'm going to kind of whiz through these slides, but I would encourage people, if you can, slap any thoughts or questions in the meeting chat, because it's really helpful. So next slide, please. So yeah, I'm going to talk a little bit about the rise of the digital Diversiast, and hopefully that'll become a little bit clearer as we work through. So next slide, thanks. So there's a couple of concepts I want to talk through that I'd like for colleagues to hold kind of as I talk a little bit further into this discussion. One will be familiar to you, one will be a little less known to you, but if we can go to the next slide. One concept I'd like to talk about is systemic BAME discrimination. I know that some people have heartache over the term BAME. I'm not one of those people myself, but that's another conversation. You could put the word race in there, but I like to be quite focused in terms of when I'm talking that language of systemic BAME discrimination. And I suspect most people, in terms of understanding that as a concept on this particular conversation, probably don't need too much explanation about what that's about, or equally are probably not sat in the corner where they're denying that it exists. But if there is somebody who kind of does imagine that actually there's no such thing as systemic BAME discrimination, I just ask you to replace the word BAME and replace it with the word gender, and just imagine trying to deny that there isn't such a thing as systemic gender discrimination. Of course, that would be laughable, wouldn't it? And I guess that's the same way I feel about systemic BAME discrimination. It exists, and there's no doubt about it. And it's not just something that exists in the United States, it's something that exists in our country too. Next slide, please. So perhaps a concept that's kind of less known to colleagues is something that I've developed as a part of my own sort of doctoral research that was completed this year. And the basic concept of my research was effectively focused on what's called senior gatekeepers. So these are very small numbers of people across this country, public-private voluntary sector, although my work was focused on the public sector, who are largely those people who can really truly make the decision as to who becomes a member of their board of directors, and kind of, you know, would be in a position, for example, to appoint the next chief exec. So it's quite a small group of people that I call senior gatekeepers. And through doing my research on these senior gatekeepers, a theme that got developed was a theme of a senior gatekeeper who is quite passionate about diversity, a diversity enthusiast. And that's the term Diversiast. It's kind of an abridge of diversity enthusiast. But the particular concept I'd like you just to bear in mind is that there's one thing about being a diversity enthusiast, but what this chart is just trying to depict is that actually there's a couple of variants of that. There's what I would call the skilled Diversiast. So this is again a senior gatekeeper who understands the importance of diversity, but also gets that not everybody will be in the same space. Not everybody will automatically agree that diversity is a good thing. In fact, some people would be actively against that. But rather than sort of totally ignoring those points of view, a skilled Diversiast will understand that they need to be able to find a way to connect to that different point of view, even if it totally dissents from where they are. And then equally, an unskilled Diversiast will be somebody who effectively basically says, unless you're on my diversity train, then you're not kind of one of me. And actually, unknown to them, perhaps they create a kind of a them and us, because unless you're absolutely on the diversity train, diversity enthusiast train, and you see it in their lens, then you're not one of them. That's what I would call an unskilled Diversiast. And I think one of the things, whether you're a senior gatekeeper or otherwise, is a thing just for you to think about where might you be on that Diversiast spectrum. Next slide, please. So just a few talking points. Some of these will make sense and they'll have a health context, and some of them will be, you'll be thinking, what's this guy talking about? But I'm not really bothered either way. Hopefully it will inspire you to think about a few things. So next slide. So first of all, just to say, I think a key part of the rise of the digital Diversiast is to understand kind of what does digital leadership look like. So, for example, in this little picture here, as a part of our trust, we host some colleagues who are called the Health Informatics Service, who provide a lot of our digital technology. And if you look at the little mosaic of 5 colleagues, Mandy is the managing director of our digital health function, as we would call it. She's quite unusual in that she's a female digital lead. That is not common. And also she's just been awarded, or was awarded a few months ago, pre-COVID, the sort of Chief Information Officer of the Year. So, you know, good prompts to her. But the other thing I think to just talk about in terms of the health informatics team, it is a white team. And the little bullet points that I've got just to the right are bullet points of organisations who are all partners of CHFT in some way, shape or form. And if you get this presentation, you'll be able to click on these. These are all key partners: Microsoft, TPP, EMIS, Cerner, people who in the NHS who produce the electronic staffing record, NHS Digital. And all I've just done, and it is something that I do on a regular basis now as a Diversiast, is whenever I'm interacting with a partner or thinking about a new business arrangement or relationship, one of the first things I will do now is I will automatically go to that digital partner's website, and I'll look for the About Us, and I will look to see what the digital makeup, so it's not digital makeup, what the leadership makeup is, what's the board level diversity that exists. And I will be honest and straight with people, it does impact then my thought process. And I also apply that same criteria to our own trust, where we know we've got some work still to do on diversity, but you know what, we're better than quite a number of others. But that's quite an important point for me, for us to understand what does the digital leadership look like, what's it look like in terms of gender, what does it look like in terms of ethnicity. Next slide, please. As a Diversiast, as I would call myself, there are some key tools in order for me to really capitalise and blend what is a digital journey and also the search for diversity and understanding it and what implications it could have. And you need some tools, and there's a couple of important tools for me here. One is just the drop-down menu on our electronic patient record system. This could be an EMIS system, it could be a TPP. For this one's actually our Cerner system, because that's what we use in our trust. And then the other to the sort of right, as you would look at screen, is our electronic staffing record, and it's a key bit of information. This is my information as it stands, which is about ethnic origin, sexual orientation, religious beliefs. Really important tools, as I will hopefully just demonstrate in the next couple of slides. So next slide, please. So those of you who may or may not know me will know that I've been involved in some national work around health inequalities, and part of that's been on the back of the real implications we've seen that COVID-19 has for diverse communities. And we've seen that some particular communities have really been devastated actually by COVID. And you know, in a few weeks' time, certainly potentially we start to see some more deaths come through than what we've experienced in the last 2 or 3 months. We'll start seeing once again the importance of health inequalities. The point I'm just making in these couple of slides, I'm in what I call a fortunate position, but I would want every single trust or organisation that's involved in providing care to be in a similar position whereby I can look at data because we are digitally aware. It's not just about the hardware, it's not just about the software, it's actually about the information that we have. So I'm able to, for example, as this particular chart shows, I'm able to look at the index of multiple deprivation. And if you don't know what the index of multiple deprivation is, I'd encourage you to Google it, because you will understand its relationship with health inequalities. But for example, in this data set here, I'm able to look at under 17 or 17 and under white A&E attendances over the last couple of years by index of multiple deprivation, and I'm also able to look at that same sort of criteria but for Black, Asian, minority, ethnic colleagues. And if I had a mouse pointer, one of the things I would be indicating is that you can see in the Black, Asian, minority, ethnic side of things, so the sort of yellowy, greeny type charts, if you look at index of multiple deprivation 1, you can almost see like there's a sort of a slant downwards to 10. If you kind of look at those data and those dots, and those data and dots represent what's called local super output areas. And so what I'm able to just discern from that really, really quickly is index of multiple deprivation 1 is most deprived. Index of multiple deprivation 10 is actually least deprived. So I'm able to discern really, really quickly that in terms of A&E attendances, more likely to be, in terms of children or under 17s, more likely to be in the most deprived, whereas when I look at the white attendances, I can see a much more even distribution. This is really important information in terms of starting to understand pathways of care. So next slide, please. And it's not just a question of how it relates to communities that we serve. This particular chart, same principle of index of multiple deprivation on the horizontal axis, and this has now got staff headcount. So this is about our staff at CHFT. So again, if I look at the sort of ready blobs, I can see that how the white distribution of colleagues works, and as you can see, there's kind of there's emphasis in indexes of 1, 2, and 3, and 4, but there's also quite a healthy representation in indexes of 8, 9, and 10. Again, if I look at the BAME staff, again I see a slight more skew towards what I would call the more deprived index of multiple deprivation. Now, some people may say, so what? What I would say about that is it's really, really important to understand that sort of data, because that's the way you start to develop pathways. That's the way that you start to move away from trying to treat everybody as one big homogenous group, and you start moving into a situation whereby you start to develop pathways that may be more appropriate for people, and you've got staffing groups who understand what certain people may or may not need. So there's lots of ways you can cut that, but I'm just giving it as an example that if you are serious and you are a diversity enthusiast and you want to take it more from concepts and into practical realities, this is an example of it. Next slide, please. There's also something I think in this digital age I think is just worth catching. So this is a picture that I managed to capture. I'm hoping that people might recognise that that's Harry Kane who's smiling there, and it's Jordan Henderson who's running over. And this is after I think Harry's got a very, very late equaliser for England, I think, against Slovenia several months ago. The interesting thing for me is one, the ability I had to capture this photo, but the significant thing for me is that if I'd taken this picture, say, I don't know, 25 years ago, and let's say it was Kevin Keegan who'd scored a goal, if I looked at the crowd behind, I wonder whether I would have seen that particular dynamic in terms of the smiling England supporters. And I think one of the points I make here is that the real importance about diversity is there's an opportunity to look and see things that in a way that typical eyes might not have recognised. And the point I'm trying to emphasise here is boy, has the dynamic changed about what you might typically expect as an England supporter. And for those people who keep thinking that somehow they can stop the tide and the momentum of diversity, I think this picture just captured this particular point. But we wouldn't be able to, and I wouldn't be able to represent that to you without the digital capability to be able to capture the photo and to be able to reproduce it like this. So that's the blend of digital and diversity that I'm trying to make. And then my final slide, or second to last slide. This is quite interesting because I think it just goes back to this point about why you need people to have digital eyes. Now, I suspect most people who potentially are on this conversation are potentially people who would get their news largely from UK sources. I get my news from UK sources, but I also try and get news and information from different sources from across the world. So Sky News, MSNBC, CNN, Al Jazeera, Fox News. I try and make sure that I have multiple sort of inputs before I start forming opinions. But this was quite interesting, this particular slide set here, or this particular slide, because this is a Sky Go app, and it's just a little picture of CNN, and typically it's the app I would use to record some of the presenters I like to see, and there is something quite significant when I look at that particular picture, which I'm not going to reveal to you actually, because I'm hoping that it might stimulate you to go and find out why would I see that as a set of Diversiast eyes, digital Diversiast eyes. Why would I say that I think Sky and CNN have got a bit of work to do? So I'll leave that as a particular thought, and then just on this final slide, please. Let's chat. Thank you.
Thanks so much, Owen. It's really great to see some data up there actually about the work that's been done, and I have no doubt that there will be a heck of a lot more work to do. And as Iftaz pointed out earlier in the day, let's us carry on doing this so our children don't have to do this this piece of work. But thanks again for your time today and for joining us.